Welcome to the District of Columbia Department of Health. In this video, we will talk about performance management and what performance management means to staff at the Department of Health. We will take a look at the basic concepts of performance management, an example of performance management in action, as well as some of the performance management tools used by the department. But first, let's start with a general overview. Our department's mission is to promote and protect the health, safety, and quality of life of residents, visitors, and those doing business in the District of Columbia. Performance management helps ensure that goals are consistently being met in an effective and efficient manner. Performance management has four types of activities: setting standards and goals, measuring work, reporting progress, and quality improvement. We use these four activities to help make our department an efficient and effective organization that improves DC's overall health. Let's take a look at each activity in more detail. When we set standards and goals, we plan our work and set expectations for what we will do. We then communicate these expectations to employees and managers, the mayor, city council, and the public. Often, we look at other health departments, the federal government, the U.S. Department of Health and Human Services, the City Council, Congress, and others in order to plan what we do and understand what is expected of our department. Once we set standards and goals, we then measure our work over time to make sure we are on track to meet our expectations. It is really important for us to measure our work in order to celebrate when we succeed or to identify problems preventing us from reaching our goals. Of course, as we are monitoring our work, we have to share information with others. When we report progress, we let managers and staff know how we've been doing. We also give our partners in the community and our residents an understanding of where we are and what still needs to improve. While we do not always meet our goals and targets, looking at our work and reporting it over time helps us to figure out why we may be coming up short on our expectations. This also helps to see where we need support, whether that support is more money and staff or more realistic goals and expectations. Now that we know how setting goals and standards, measuring work, reporting progress, and quality improvement work together, let's take a look at how our department uses the four areas of performance management to help our city. As you may know, the district has many restaurants, which means that there is a great potential for people to get sick if food isn't prepared correctly. As a department, one of our responsibilities is to prevent the outbreak of illness from food, and we do this by inspecting restaurants. We look at a lot of different things when we set our goals and standards for restaurant inspections. First, we can look at different standards like Healthy People, which sets goals for the entire country that relate to health. For example, Healthy People says that we should have no more than 11.4 cases of Salmonella, which is a bacteria found in foods per 100,000 people. We can reduce foodborne illness by inspecting restaurants to make sure they are serving food that won't make residents sick. Knowing our resources, like how many employees we have and the amount of time it takes to inspect a restaurant, we can set a target for the number of inspections that happen within 1 year. As we go through the year, we keep track of the work we do by counting the number of inspections resulting from complaints that were conducted, as well as look at the reports given by the epidemiologists on foodborne illness. We then report this progress regularly, maybe every 3 months, just to make sure we will meet our goal. Once we reach the end of the year, we can see how we did. By keeping track of the number of inspections done each year, we can learn how our department works and figure out areas to improve the quality of our service. Now that we know the basic concepts of performance management and saw an example, let's take a look at some of the tools our department uses to ensure our programs like food safety carry out their part of our department's larger mission. It is important for all employees to be knowledgeable on the following tools: Healthy People, Accreditation, the Agency Performance Plan, the Annual Performance Accountability Report, and your employee evaluation. As we talked about earlier, when setting goals and standards, we look to what other departments do and our partners like the federal government. When improving our residents' health, we use Healthy People to set our goals. Healthy People is a national initiative that provides 10-year goals and targets for residents throughout the U.S. For example, by 2020, Healthy People has stated that we need to reduce death from strokes to 42.2 deaths per 100,000 people. These targets help our department to identify priorities. These goals are measured over a 10-year period, and progress toward these targets is reported periodically. We use Healthy People to make sure our residents get the best health possible. For more information, check out the National Healthy People Plan and DC State Level Healthy People Plan online. Just like with Healthy People, there are other national organizations that help us set goals and standards. The Public Health Accreditation Board, also known as FAB, is the accrediting body for health departments. In order to receive and maintain accreditation, our department must ensure that we meet and maintain their standards. Accreditation helps our department ensure that we serve our residents effectively. In our agency performance plan, our department is required to select annual goals and report our progress to the city administrator. This plan is used to evaluate agency performance at the end of the fiscal year, and DOH's progress is reported in the annual performance accountability report. We use this information to improve our department. Alongside with the agency, our city requires that each employee have an employee performance plan. This plan sets individual goals, measures each employee's work, and reports progress for each year. It also includes sections for employees to improve their work by attending trainings or completing online courses. Employees' goals should align with the larger agency and should contribute to helping residents. Employee evaluations summarize how well an employee succeeds in meeting the expectations outlined in the individual performance plan. They provide feedback to the agency on the ability of the staff to reach the stated goals and targets of the larger organization. Our department uses a variety of tools to set standards, measure our work, report our progress in reaching our goals, and improve the quality of our work. Performance management ensures that the work we do has an impact on our residents and improves the quality of their lives. Working as one department, we can help make DC healthy. If you have any questions, you may contact Heather Reffett with the DC Department of Health. She can be reached at 202-442-9186 or at heather.reffett@dc.gov. Thank you.